It is 1 o'clock, so we'll go ahead and get started. First off, thank everybody for joining us today. We're excited to be back for another Highlander Wisdom webinar. This week, we're very excited to have Lynn Newberry with us, class of 91. And she's going to talk to us about the healthcare field and making sure we choose what's best for us as people, when we're making decisions in the healthcare field, what's the best to choose. So I'm going to turn it over to Lynn. And if you have any questions, feel free to write them in the chat. And we will be sure to answer them as we go. So Lynn, I'll turn it over to you.
Great. Thanks, Frank. So my name's Lynn Newberry, and like Frank mentioned, I graduated from Radford in '91. So when I was approached with doing this webinar, I thought, what a great way to be able to share information from one, my own personal experience, but two, as a professional nurse, working in a variety of hospitals that I've experienced several different things. And I wanted to share them with you because I think it's important as healthcare consumers that we do have a choice. And we're going to talk a little bit about, and I'm going to present some information just really that you can use and put in your toolkit to make decisions. So with that, I do want to give a shout out to all of my nurse colleagues out there. This is the year of the nurse, and we had no idea that it was gonna be the year of the nurse the way it has been. So I know that it has impacted so many of your lives in a variety of different ways. Many of you are probably working from home right now. So this is officially the month of May is Nurses Month, with particularly Nurse Week running from the 6th to the 12th. So it's also Teacher Appreciation Week. So shout out to all my teacher education colleagues. So for me, as a nurse, this is my beginnings and into present. I graduated from Radford with a bachelor's degree in nursing and spent many years in the emergency department. Went on to get my master's from University of Virginia and then my doctorate, which is a DNP, Doctorate of Nursing Practice in 2017 from Old Dominion University. I have to say that Radford has changed quite a bit since my time back in the 80s and early 90s. As you can see, we did crazy things like swimming in the fountain. Can't do that now because it's surrounded. But I'm very active with my alumni chapter of Alpha Sigma Tau. So shout out to all my sisters who are probably trying to poke me this afternoon. And as well as loving to attend Radford University events. So one of the things that I do now, I'm probably in the best job. I'm in the best job that I've ever been in as a professional nurse because I have the opportunity to talk to nurses from across the country and the world about nursing practice. And so I work for the American Nursing Credentialing Center, which is part of the American Nurses Association. Many of you guys have probably seen the American Nurses Association and read about the advocacy programs that are going on right now for nurses and healthcare workers related to PPE, that is the appropriate PPE to protect ourselves so that we can take care of our patients in the best form possible. With that being said, I do work for the credentialing side. American Nursing Credentialing Center has several programs. I work with the Pathway Designated Program and the Magnet Recognition Program, and I'm going to talk a little bit about those this afternoon. When you have the opportunity to make those decisions, those are credentials that you would like to see in a hospital environment as well. ANCC also is the credentialing arm for professional nurses for nursing certification. So from a continuing education standpoint, they are the gold standard. So let's talk a little bit about a couple of things. I do want to make this interactive. So this is where Frank's going to help me with the chat box. So I want you guys to just chime in and make comments about things as we go through this presentation. So think about a time when you made a major decision. What was something most recently that you've had to think about that was very costly? Maybe a major purchase such as a home or a car. What was some of the things that you have had to think about and really take some time to make considerations on? Frank, anybody chiming in?
Nobody's chimed in yet.
What? Nah. All right, I'm gonna have to get on the phone and start texting some of my friends.
Somebody said they purchased a car in November. Somebody said buying a house.
Right. Okay. So big purchases, so when you think about big purchases, what are some of the things that you do? You spend some time doing some homework, and maybe, looking at considering where you want to live, the type of car that you want to drive. Cost is a factor. Does it have good coverage? Are there warranties? All of those kind of things are things that you factor in when you're making a big purchase. Well, the same things should be considered when you are choosing a hospital and your healthcare provider. So in total, there are 6,146 hospitals in the United States. So that's a lot of choices, obviously, but think about when you're sick. If it's obviously a life-threatening emergency, you're going to go to the closest hospital that's available, regardless of whether it's in your community or not, because depending on where you're at. But when you're sick, you again may need to go to the closest hospital or where your physician practice. However, we also know that research shows that some hospitals do better job at taking care of certain types of patients and conditions than other hospitals. So as a healthcare consumer, I'm going to talk a little bit about that, and I'm going to use a case study example and just give you some information now to think about as you are making those decisions. All right, looking at the changes and challenges of the current healthcare landscape. I'm sure that many of you guys watch the news. I have gotten to the point where I am really challenged with it's stressful to watch it because of everything that's going on. But when we think about healthcare and the current challenges of the healthcare landscape, there are several things to take in consideration. And it may provide you with a baseline knowledge of understanding of why the healthcare system is so complex, and why we struggle as a country on how to decide what's the best way to handle it. There's payment model changes with health insurance coverages. We see an increase in changing regulations, and I'm going to talk a little bit about the regulations and how many there are. And then there's the caring for the aging population. We know that the bulk of the money is spent in the later years of our lives for healthcare expenditure. We are a country who takes care of diseases. We are not foundationally known for a preventative healthcare model. So that is some of our challenges that we think about when we are looking at healthcare in general. Healthcare regulations. The American Heart Association actually did several studies and picked apart the healthcare system in the United States. They found that there were a total of 9 domains with 629 regulatory requirements that a hospital has to comply with in order to receive reimbursement. So if you think about all the money that we spend trying to justify what we're doing from a regulatory standpoint, that's part of our challenge. The Institute of Medicine is something that you may be very familiar with. They're doing a very great, and we'll put a little plug for them for their wonderful webinar series that they have right now on COVID-19, as well as information about taking care of yourselves. They look at it from a very holistic and community-wide approach. but we know that healthcare system remains plagued despite all of the regulatory and safety and quality compliance measures that we've got in place. We know that despite all of this, healthcare and having a highly educated, trained staff, medical errors still occur, and they are the third leading cause of death. So back in 1970, the Institute of Medicine was founded with the National Academy of Medicine that made up several national academies for the United States that were looking at addressing these issues. And there was a landmark report that was generated in 1999 by the Institute of Medicine that focused on all these medical errors. So it was really during that time in the late 1999 and into 2000 where safety, patient safety, and the quality issues were coming to light. So for this push for patient safety, it released a huge report. And this showed how many patients actually die in the healthcare cause. And some of the interesting things is that you may have heard of what's called a Swiss cheese model. And the Swiss cheese model is when you line up everything, your patient's not supposed to fall through the cracks. Unfortunately, they do fall through the cracks at times. So this becomes a challenge, and this is why the regulatory agencies are so important, and why you as a healthcare consumer have the ability to make some decisions. So back in 2008, Robert Wood Johnson Foundation and the Institute of Medicine launched a 2-year initiative that really assessed and transformed the nursing profession. And so out of that 2010 recommendation was the white paper that was actually presented called The Future of Nursing, Leading Change and Advancing Health, with the purpose of making recommendations that we in healthcare and in nursing use as a foundation at this point. So how many of you guys, and again, this is another participation, how many of you have heard of CMS? Center for Medicare and Medicaid Services. All right, I see some raising of hands. All right, somebody knows how to use Zoom. Fabulous, thank you. All right, and then there's Hospital Compare. So Hospital Compare is a government tool that is used from Medicare and more than 4,000 hospitals, actually almost every single hospital. If you want to be reimbursed by the federal government, you're going to participate. So with that in mind, Hospital Compare is part of the CMS, and it measures a variety of quality indicators. So some of you may have heard the overall hospital star rating. Every once in a while, you'll see this in the newspaper where your community hospital is being published and they talk about they received a 5-star or 4-star rating from the CMS. They also have a survey of patients' experiences, and I'm going to talk a little bit about that here in a moment. Other measures that they do measure are timely and effective care, complications with deaths, unplanned hospital visits, and then another big one that any of you have been in healthcare may have heard of value-based purchasing. And that is something that is very new and is really cutting edge when we look at from the healthcare standpoint behind the scenes. So patient satisfaction. How do you choose where you go to get your care? So this is another participation. How do you make the decision of where you go and get your care? Is it based off of the staff being nice? What are some of the things that you look for when you go to receive care?
Someone said where my doctor goes.
Mm-hmm. Okay.
Location and ease of access.
Great, yes. No one wants to have to drive 2 hours to go to receive care. And so we've turned into the McDonald's or Burger King, have it my way. and as we have looked at how we want to receive our care, as well as the fact that we do really want to make sure that we are receiving good care. Nobody goes to the hospital with the intent of being treated poorly or not receiving the effective care. Patient satisfaction actually has grown in notoriety over the last couple of years because hospitals have really had to focus on part of this as part of their reimbursement. As I mentioned before, this is part of the CMS guidelines, and for Medicare and Medicaid patients, for reimbursement from CMS, 30% of the total data points for reimbursement does come from patient satisfaction. So it has really turned the healthcare industry upside down, and they're having to adjust their strategic plans accordingly to meet our patients' needs. There are a couple other things to think about when you look at healthcare. You may notice that your hospital may say that they are Joint Commission accredited, or that they are accredited through the Healthcare Facilities Accreditation Program, or DMV, or Center for Improvement in Healthcare. These are four of, oops, excuse me, I just flipped the slides, sorry. These are four of the healthcare accrediting bodies that are promoted and approved by CMS. So not only does your hospital have to go through a state survey and a state agency, so your state health department comes in and inspects, but then there are one of these four organizations your hospital and your community has to use. Now, some of them have been around the block for quite a long time. The Healthcare Facilities Accreditation Program has been in existence for a little over 75 years. The Joint Commission has been around for around 50 years, and each one of them are very similar to their approach, but they also are required to survey your organization every 3 years. Another organization that is fairly new and has worldwide recognition is DNV. They're based out of, I believe it's Finland. But they are really increasing in their existence. And in the Virginia market, there are quite a few hospitals and health systems that actually do utilize that. My personal experience has been with the Joint Commission through my years of nursing experience. And the last one is CIHQ, which is the Center for Improvement in Healthcare Quality. And they, again, are looking at making sure that your organization where you receive care meets the minimum standard. So as I say that, it's minimum standards that they are meeting for these regulatory compliance. So then there's other things that hospitals do to make sure that they are recognized accordingly for the great work that they're doing. There are several that I'm sure that many of you guys are familiar with, and those include the health grades. So some of you guys may be familiar with that. You can go online and type in health grades and look up your physician. And it's kind of like Yelp, if anybody uses Yelp for looking for restaurants or places to go. It gives recommendations from consumers. Leapfrog Hospital Safety Grade uses a 5-star, or excuse me, Health Grades uses a 5-star system, and the Leapfrog actually uses letter grades, like in school, A, B, C, and D. So A obviously being the best. This is coming from driving quality and safety outcomes for patients. So they have a number of ways that hospitals actually participate in these to provide additional information above and beyond the basic data that is required for the federal government to submit. So you can imagine, again, it goes back to the number of staff that hospitals have on staff and the cost of dollars to be able to show that they are showing great outcomes. And then the last one is the U.S. News and World Report. And that I'm sure many of you guys have seen. Lots of hospitals use that. You'll notice that, you have some large hospital health systems that will have this on either their banner on their outside of their hospital or maybe on their website. So go back to your homework assignments, go back to your hospital, Google them, look up their information. They probably do have a page with all of their awards and recognition, so you can see where their most recent comes from. This U.S. News and World Report is based off of the best hospitals for 16 different specialties is what they look at. And they focus on the Donna Beatty model of structure, process, outcomes, as well as looking at patient satisfaction scores. Some of you may have heard of that called HCAHPS scores. And I'm sure that if you have been to a hospital and received health care in the last several years, you have probably either received a phone call, which you may have thought was spam, or a letter that you may have thought was a bill from a hospital, but it's actually from, and typically it'll look like a third-party vendor. So it may be from Press Ganey, it may be from PRC Picker, it may be from NRC. There's a variety of hospital vendors that work with companies to gather that data and then benchmark it against other hospitals. So the bar is always moving. So for hospitals, this can be a challenge, but it's also a very healthy competitive challenge. So I'm going to talk about 3 awards that are accreditations that are not required for financial reimbursement. However, are really great to recognize the incredible work that your organization and the hospitals do for your patients within your community. The first one is the Malcolm Baldrige National Quality Award. And is there anybody on the line that's in the business world that's familiar with Baldrige? Can you raise a hand? They also, they provide awards annually in 6 categories: manufacturing, service, small business, education, healthcare, and nonprofit. So they've been around since 1987, and they were established by the U.S. Congress to raise awareness for the quality management program and recognize U.S. companies that have implemented quality management systems. So it's all about the outcomes. If you do the right thing for your patients, then you're going to have your better outcomes, and as well as for your staff. So this is one of the 3 recognition programs that are available for hospitals to tout as being outperformers. The other 2 are from the organization that I work for, from the American Nursing Credentialing Center. The first is, first let me tell you a little bit about ANCC. Like I said, they're a subsidiary of the American Nurses Association, and their mission is really to promote excellence in nursing and healthcare globally through the credentialing process. So it's not only an American credential, organizations across the globe have chosen to use the framework for Magnet as well as Pathway to build their healthcare structures to be able to have positive outcomes for their patients. The Magnet Recognition Program is the most prestigious designation for healthcare organizations, and it is based off of nursing excellence and excellent patient quality outcomes. So not only do you need to meet the bare minimum, such as getting reimbursed for your organization through CMS, but you need to outperform the benchmark in your categories for your evaluations. So things when you think about, if you're in the hospital and you have a fall, that's an untoward event. If you have received medication that you were not supposed to receive, that is an untoward event. So what Magnet looks at is addressing quality indicators. The term Magnet actually came from a research study where 4 nurse researchers wanted to study hospitals across the United States and figure out why certain hospitals had specific characteristics. They were called the 14 forces of magnet. And it was because of those magnet characteristics that they retained and attracted highly qualified nurses because of the excellent outcomes. Hospitals that are known for nursing research and being able to make sure that nurses had a voice in their care of their patients as well as their practice environment. The ANCC also has the Pathway to Excellence program, and that is known for positive practice environment. And that is based off of 6 practice standards. And this program actually originated from the state of Texas, from the Texas Nurses Association, where they were looking at hospitals and wanting to recognize some of the smaller hospitals across the state and how they provided excellent outcomes and a positive work environment for nurses. As we've seen a lot here recently in the news, nurses have really struggled with not having access to the tools and equipment to care for their patients, and it's frustrating. And so some of the things that you probably may have read about have been nurses who have been furloughed as a result of not being able to take care of their patients because their departments are closed, as well as nurses who are on the front lines in the emergency department and the intensive care units who don't have access to the right equipment. So one of the foundations for Magnet and Pathway is really about making sure that there are structures and processes in place for hospitals to be able to have the equipment for nurses to do their jobs. So I say all of this because what I want you to be able to do with this information, and it's a lot of information, is for you to consider how you would take all of that information and decide where you need to go for your care. So let's use an example. Let's say that you have a bad knee. Any of us that are fastly approaching 50 or going past that probably can talk about any of our aches and pains. So let's use our knee as an example. You've been to the orthopedist. He says that you need a total knee replacement, but you've got several hospitals in your community and you're not sure exactly where you want to go to have this knee surgery. What would be some of the considerations that you would take into account? So again, back to sharing. Would anybody like to chime in and say how they've made a decision based off of that to go and get surgery?
And if you want to join in, you can raise your hand and I can actually bring you on to be able to talk so you don't have to type all this out.
Oh, thanks, Frank.
Absolutely. Somebody said success rate.
Yeah. Okay. So great. Yeah. So think about it. You know, there are hospitals that are world known for certain procedures. So if you have the opportunity to take that into consideration, that is something that you definitely want to do. So let's look at that. So factors to consider. First, you think about the hospital in which your physician has what we call privileges. So first, you want to consider, you know, which orthopedist that you want to go to. Maybe you've wanted to get a second opinion because you really are not interested in having surgery. You know what that effect's going to be, and so you want to consider the second opinion. And then you also want to find out where the physician actually does surgery. So ask him or her where they do surgery and where they recommend. They will be able to provide that information to you. Now, obviously, that's their opinion. So some of that is based off of their experience, just like it is from, you know, even asking your best friend where you think you should go to have surgery. Other things to take into consideration is obviously going to be, like I've mentioned before, hospital ratings. You can actually go on Google and type in hospitalcompare.gov, and you can see ratings. They are about 2 to 3 quarters behind. So when you think about it, that's almost a year. Behind with the data that is publicly reported. However, you can make a determination based off of hospital ratings. You can also take into effect looking at, like I mentioned, US News and World Report. Any of that information is publicly reported. So you can even go to your state's health department website and find out surgical site information. So when you think about having surgery, that is definitely something you want to take into consideration. The other thing is, of course, who's going to pay for this and how is it going to be covered through your insurance coverage. So you want to make sure that you talk to your insurance company and find out where they cover. Do they cover out of coverage? Do they cover out of your area? Do you have to have special permission? All things to take into consideration. And then maybe you don't necessarily actually have to have surgery. Can you consider having alternative therapy? So that's another thing to take into consideration. But let's say that you've decided that local is not good enough. You have something that you need to go and get a specialized procedure because of the nature of this knee injury. And so you may have to take into consideration, again, that insurance coverage, but then you've got to factor in travel and lodging. And, when that happens, are you going to bring your family members with you? Is this going to displace you from your family? How are you going to end up taking care of those pieces? As well as the fact that you also want to take into consideration isolated care. And I say that in the fact that when you're not close to home, how are friends and family going to be able to come and stay overnight or help take care of you and arrange those types of transportation and so forth, going back and forth to receive care? And then the last thing, obviously, with the events of COVID right now, is the new policies that are in place related to family care related to COVID-19. So I'm sure that many of you guys, if you've been to a hospital or if you've heard about any of your friends having to go to the hospital right now, we're just now starting up in many regions elective surgeries or cases where you can go to actually receive even basic workups, because we've been so concerned with the spread and containment of this virus that we want to make sure that we keep people safe. So that's definitely been something to take into consideration. And I think that we're going to see an evolution of policies to change related to family. One of the key pieces when we think about patient-centered care and the mission, vision, and values of organizations to meet their strategic goals so that they are delivering the best care for our patients, that does incorporate the family. So we've got to figure out what's the best way to do that. So now you've got a few tools that are in your consumer toolbox. You can make your own checklist based off of this information, and there's tons more of information. I could have talked hours about how you can make this determination, and you can spend hours on the computer looking this information up. Any questions that you may have for me?
So I do have a couple questions that have come in. So the first question I have is there any way to price compare when you're looking at your options?
Yeah, actually there is. So you can work with your surgeon to find out what the cost is. And I mentioned the term value-based care. So some of the things that hospitals are doing now related to value-based care, and there's only a few what we call ICD-10 codes that are coded this way right now, but there's there's a trend to move into this direction. Knee replacement surgery, hip replacement surgery, shoulders, heart bypass, things of that nature, gastric bypass surgery. The federal government is looking at what are the best practices, and value-based care is bundled care. So it's like going and purchasing something, and let's say you're going to bundle the entire vacation. So you pay for your airfare and your cruise and everything, and all your food is covered in that. So value-based care is the same piece, where it covers the physicians, their fee, as well as the hospital fee, as well as post-op fee. And so hospitals are doing that so that they can show that they have excellent outcomes. And by doing that, they work with insurance companies to bid for these. I can tell you that the hospital that I used to work for, we were an orthopedic hospital. And one of the things that we did was we specialized in bariatric surgery as well as orthopedic surgery. And we had received a contract with Walmart, out of all places, that we were two of the hospitals in the country where patients could come from all over the country that were employees of Walmart to receive gastric bypass, and that their care was covered through that because of this value-based care. So you can get a cost analysis. The challenge is, again, that's you're looking at if you're paying for it out of pocket. There are people who actually come to the United States to receive health care because in some countries, you are on a waiting list for years. So let's use the example of the total knee replacement. You would have to actually get yourself on a waiting list and then suffer with the pain until your name comes up to actually have that surgery. So if you could financially afford it, organizations are actually creating programs where you can have your knee replaced and recover, and it's a bundled package. So it's interesting as a consumer. I think the more that we as consumers are informed, we have the ability to ask questions and demand for our care to be appropriate.
If anybody else does have a question, feel free to write it in the chat box and we'll get to it. I know there's some people watching on Facebook as well. If you can comment in there as well and we can read those questions. The next question I had was, would you recommend, with COVID and everything going on right now, would you recommend still waiting on these elective surgeries, even though things are starting to open back up, or would you say it's okay to go ahead and move forward with those?
Well, it depends. I think that you have to take in consideration what's going on in your community. The challenge is that you can go to a variety of websites, including your health department, and gather data to see the number of reported cases that you have in your community. However, that doesn't always actually indicate truly what's going on. The best recommendation is to really talk to your physician, because they're going to be able to guide you. Physicians are really not controlling a lot of it right now. It's really being controlled by the hospital as well as our state government. So the governors have a huge control over what is going on in the healthcare at this moment, and really their attempt is to do the best thing for their patients and look at the general good. So I do know that dentists are starting to open back up with being able to do procedures. I think it's just something that you have to take in consideration. My personal opinion on really the whole virus component is that as long as you are doing the right thing and hand washing and so forth, I think back to Florence Nightingale and everything that she wrote about and talked about and learned through her experience in the Crimean War that she found is still true 200 years later. If you have a clean environment, if you're washing your hands and you're covering your cough and doing those basic things, the spread will stop. So that's part of this whole piece of the face mask and being able to have your social distancing. So, not only do we need to remember that, not only with COVID, but with other viruses and germs and bacteria. So really talk to your physician and to determine, what's the best case for you, what's the best timing, especially if this is something that, if you need to have it done right now, there may be further sequelae as a result of not having the procedure done. So.
Yeah, and if you have a question, you can also raise your hand and I can bring you up and you can ask it without having to type the question. We can actually bring you in as well. And you did touch on this a little bit earlier, talking about obviously with COVID, people can't get into hospitals right now to be with family members. What's the best way for to get information about your family member that is in the hospital?
Right.
And is it going to be different if you have a child in the hospital versus if you have a parent or a sibling in the hospital?
Right. So yes, HIPAA. So many of you, when you've been to the doctor's office, you've probably signed the form releasing information, giving you permission to release information to family members. So if you've not signed a HIPAA form to grant even a spouse, a parent, a child, information, you're not going to get information about your family member's care. Now, when I say a child, I mean adult child. So if you have a minor, they're still going to take special precautions. And that's some of the challenges that, the pediatric nurses are having to work through too, is how do we incorporate that family environment and be able to make sure that we keep everyone safe, including the parents. So really important is another thing is to have a conversation with your family members about your wishes. And I won't get on my soapbox about, making sure that you have these life-ending conversations. But it is important for people in your life to know what your wants and your wishes are related to your healthcare. Should something happen in your life where they need to help make that decision for you.
I have a couple more questions that have just come in too.
Okay.
One of them being, what can community members and family members do to support nurses in times like this, as well as other times?
Oh, that's a really good question. So, honestly, there's so much outpouring of support right now, and for the healthcare workers across the United States and the world. It's been incredible to see the videos. When it first happened over in Europe and seeing people cheering. And I think we've gotten very creative with our social distancing that we've created with being able to show support. I think the biggest thing is to know that nurses are out there advocating for patients every single day. And it is a very, very challenging job. Anyone that's in the police, fire, EMS, statistically, you will see lots of research that's done related to the mental health awareness component and post-traumatic stress syndrome. I think that's going to be part of our second wave that we see with COVID. We're starting to talk about how we're hitting the peak, and then we're going to see it die back down throughout the summer, and that we are anticipating another peak again in the fall with COVID. But it's the aftermath of caring for patients in such a challenging time that it wears on you. And even in a normal situation, Mental health is a huge component in the healthcare industry that we take for granted, because we go into healthcare to take care of people, and oftentimes we forget to take care of ourselves. And so one of the things that's really important is to really think back of how to take care of yourself so that you can better take care of your community. And so as a healthcare consumer, it's just really making sure that you do what you need to do to take care of yourself. Um, and, um, and I think if there are community resources to reach out to in your hospitals, after all of this is said and done, you know, volunteer programs are back out there, but you can certainly reach out to any of the community programs and see what folks are doing. You know, it's gone from making face masks and sewing. So we've crafted, you know, pulled out all of our crafters out there to just, you know, making sure that they're getting food. But it's not just the healthcare workers that are out there that are having these challenges. So many folks, you know, we need everyone. We need the people on the front lines to be able to deliver the supplies. So that's been some of our challenges, you know, and of course everybody's seen all the memes with toilet paper and all the crazy stuff that's went around with that. And anybody who's been in a grocery store lately, you're now limited to how many rolls of toilet paper and how many pieces of chicken you can buy. But that's just so that we make sure that everybody gets an opportunity. But, you know, going back to how you can help the nurses in your community is just to realize and understand that they're humans too, just like anyone else. This is, like I said, we're going to see a second wave, and I think mental health is going to be a huge component.
What is your favorite part about being a nurse?
Oh gosh. All right. Who's asking all these questions? I've had a lot of really great experiences in the last 29 years. You know, I spent many a year working in an emergency department in a level 1 trauma center. So when I graduated from college, I thought I knew everything. And then I went and worked in an emergency department and realized there's interesting things in this world. And so you can only imagine the stories I could tell, but I probably won't share them all on on the live webcast. I think the best thing for me from a nursing standpoint is that as a nurse, you don't necessarily have to be touching and taking care of a patient every single day in order to do nursing. So that's, you know, in my role, in the last 3 years, I've not been at the bedside or in a hospital environment because I've been working for the American Nurses Association. But do I still make a difference and get to make an impact on healthcare? Yeah, and probably more so from a global perspective than I ever did working in a hospital environment, because I'm working with policy changers and being able to go out on the front lines and advocate and teach and talk to people like you guys, you know, to really help you understand what's going on in healthcare. You know, I do miss the times where I get to take care of patients and get that feedback. So at this point in my life, it's taking care of my parents that I've turned into the healthcare provider. And then, of course, wink, wink to all of my sorority sisters are out there that text me and call me often. So, you know, I get to do it in that sort of fashion now. So it's kind of hard to tell you what's my actual favorite part of nursing.
And I just had a couple more pop in. So one other question was, for students that are looking at pursuing a career in nursing, do you have any recommendations for them?
Yes. You know, really be very serious about your interest in doing this. I ran a new graduate residency program for a number of years in the hospital, and some of the things that we did find was that you know, while healthcare is exploding with the fact that there's plenty of jobs. We're in a nursing shortage. You have to go into healthcare because you want to take care of people and that you want to interact with people. And so that's some of our challenges, is that, yes, there's really cool technology and there's lots of stuff that you can do that's highly technical. But there's the art and science of healthcare. And so the art of healthcare being the fact that you really have to have that desire to want to help people. And sometimes helping people doesn't necessarily mean that you save them. It's helping them to have a death that is beautiful. And so it can be challenging, because I think that unless you've been exposed to it, and it's not just the anatomy and the physiology, and yes, it's very hard and it's very rigorous program, and sad to say, there are not enough people that are in healthcare education to build programs such as the awesome program that actually Radford has a very high percentage rate of nurses who pass the boards. I think actually they're 100%. So, we do have great programs in the state of Virginia, and now that Radford University has combined forces with Credentialing and working with that new program, I think that is really going to help Radford grow. But you've got to be truly interested in doing it, because it's a tough profession. There were many days when I first graduated from nursing school that I didn't know that I had signed up for this. So, and I'm sure that there are plenty of nurses right now who have said that right now on the front lines taking care of COVID with the challenges that we're seeing. So, yeah.
So I have a question.
Yeah.
And if I don't understand it, but maybe you will. And if we need more information, we can always bring them on if we need to. Have you ever heard of medical professionals accepting retainers or membership type fees for remote medicine or video-based examinations?
Okay. So are you talking about telehealth? Are you talking about like going and receiving health care through the way of using a computer for interaction with a physician or a nurse practitioner?
Yes.
Yeah. Mm-hmm. Actually, that, now that we've got COVID, that is going to boom. And I think that has a whole new space that we're going to need to explore and figure out what's the best way to do this. The challenge will be that you have an older patient population who is not willing to participate in and doesn't have maybe even the skill set to participate with using the computer and the phone to do telehealth. It does work very well in rural environments when you need to have follow-up. I've actually used telehealth myself. I've actually got an appointment this week to see my ENT because I can't get into the office because the office is closed. But I'm still going to be able to talk to my surgeon and do follow-up care. So it does have a place in healthcare.
And then my last question, unless another one comes in, is there somewhere, the question is, where do we get news? Because obviously with everything going on now with COVID, where do you get the most accurate information with what's going on to ensure you're getting the right stuff without assuming there's an agenda behind it or anything like that?
Sure. That's a challenge even for us in healthcare because there's so much fake news that's out there and produced. And I'm sure you guys have all seen the memes where, the news media has used the same picture for the same story, and it's been happening in two separate places. Honestly, it's really hard to say. I think that you have to really what you have to do is you have to listen to all sides and then make a decision what you feel is right. Like I said, I mentioned the statistics from the health department perspective. They're doing the best they can with managing the pandemic. And this is, we haven't had this type of event in our lifetimes, and there's very few people that are still in this world that were around that could recall the Spanish flu back in 1918. So the challenge is to really make sure that you read and you decide and you use good resources. So when I say good resources, I'm not going to pit, CNN and Fox against one another. But it's really about making sure that, you're taking your information from as best and most reliable sources possible. There are huge health programs that are out there, the Mayo Clinics, the Cleveland Clinics, you've got Duke, you've got large healthcare systems that are gathering this information. There's actually, from a nursing perspective, we use what's called evidence-based practice. And so that's by going and reading the literature that is available and out there. And that's based off of research studies. But then you have to think about how long it's taken for a research study to come into light and to be able to apply that. That, can take up to 7 years before a research study comes into place where you can actually apply those skills. So universities such as Ohio State University actually have an evidence-based program for healthcare providers. It's available to the public. You can go and look it up. And what they've done is they've actually, related to COVID-19, they've actually pulled the resources, they've taken the literature, and they've put together webinars to advise people on what is currently going on and how to move forward with that. Other organizations have done the same thing. The American Nurses Association has tons of resources and information and webinars that are available to the consumer as well. And then the other one that I had mentioned and put in a plug for, that's with the National Academies of Health. They're available and are free resources that are available to the consumer too. I think, even for, like I said, even for myself in healthcare, it's really hard to gauge because I only know what's going on in my backyard and in my community. And I live actually in the Outer Banks of North Carolina, and our island has been shut down since actually for about a month now. And unless you are a resident or you are someone who has a priority job that you need to be on the island, you are not allowed on the island. So with that in mind, we've had 16 cases of COVID. Can we live and sustain like this? No. And so, that's part of the challenge, is knowing what's going on in your community and then just making informed decisions based off of that.
So that is all the questions that I have at this point. If anybody else has any more questions, feel free to chime in real quick. I do want to give a quick plug for next week, or for later this week. We're doing another webinar on Friday at 11 a.m. with the Radford women's golf coach, Jeff Beeler. He's going to teach us some tips to improve our short game and hopefully improve my game altogether. So we're really excited for that. So if anybody is interested in improving your golf game, definitely check back with us on Friday. It'll be we're taking it out to the golf course. So it'll be a little bit different this time around. But if nobody has any more questions, I want to say thank you for joining us today. A special thank you to Lynn for being our presenter this week. And we're definitely learned a lot of information, and thank you for joining us.
Of course, my pleasure. Glad to be here.
And everyone's saying great info, thank you. Getting a lot of thank yous, a lot of highs from people on Facebook as well. So with that being said, we will end it here. So thank you everybody again, and until next time.
Great. Thank you. Bye.
Bye.